Hey guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today we're going to talk about achalasia. What is achalasia? Before we go any further, I want you to understand that this video is for educational purposes only. If you have any questions or concerns, please contact your primary care physician or physician assistant for further evaluation. Now, what is achalasia? Achalasia is the most common esophageal motor disorder. The etiology at this point is not clear, but it is thought that there is damage to the nerve cells in the esophagus. Therefore, the lower esophageal sphincter fails to dilate. The lower esophageal sphincter, which is right at this point right here, it fails to dilate, and when the patient eats, the food tends to hang out in the esophagus, and eventually the patient will develop a stricture in the distal esophagus. I want you to keep in mind this type of a stricture right here. What are some of the most common symptoms of achalasia? Some of the most common symptoms are esophageal dysphagia, which is trouble swallowing, vomiting of undigested food, unintentional weight loss, and sometimes chest discomfort in the middle of the chest. And it does make sense because this area right here is going to be inflamed and irritated. Let's say you suspect the patient has achalasia. The patient is experiencing the symptoms and you suspect the patient has achalasia. What are you going to do next? You're going to obtain a barium swallow study, and this study will give you specific keywords such as bird's beak. And that's why I was telling you to keep an eye in this area, because it will give you that bird's beak. You see right here, that bird's beak. That is what is shown in the barium swallow study. Now you have that study done, but you want to confirm achalasia. The next step is to obtain an esophageal manometry that will measure the distal esophagus, and it will give you the actual diagnosis. But you can't stop there, because the patient was experiencing trouble swallowing, unintentional weight loss, and nausea and vomiting. You should always obtain an upper endoscopy, which is an EGD. And why will you obtain that? Is because you want to assess for malignancy or eosinophilic esophagitis. The upper endoscopy will place a camera down the esophagus all the way to the stomach and the duodenum. The EGD will give you tons of information about the esophagus, about the stricture, about the stomach. Make sure the patient doesn't have a stricture at the pylorus, and it will take random biopsies. Now, the biopsies have now resulted, and it is negative for EOE and negative for malignancy. What are you going to do next? You're going to start some type of treatment. You need to consider a diet that is easy to digest, usually a full liquid diet to start off with, and you're going to consider a dilation of the distal esophagus with a balloon that is placed in the esophagus, inflated, and it improves the stricture. It does not fix the stricture, it improves the stricture. You could also consider Botox injection to relax the area, and you may need to consider surgical intervention such as a Heller myotomy or a POM, which is an endoscopic myotomy. In conclusion here, achalasia is the most common esophageal motor disorder with an etiology that is not truly known at this time. Some of the symptoms are esophageal dysphagia, which is trouble swallowing, chest discomfort, nausea, vomiting of digestive food, and unintentional weight loss. The way to diagnose it is to obtain a barium swallow study. To confirm the diagnosis is to obtain an esophageal manometry, and you need to also get an EGD to assess for malignancy and eosinophilic esophagitis. Lastly, the treatment is to dilate the stricture, which is only going to give you a relief of the symptoms so the patient can eat. Also consider Botox injections, and if surgical intervention is needed, likely the patient will need a Heller myotomy or a POEMS, which is an endoscopic myotomy. Guys, if you found this video helpful, please click like, subscribe, and I have to ask you a favor. If you have any type of diagnosis that you want me to go ahead and explain in simple terms, please put it in the comments below, and I will be more than happy to do so. I'll see you in the next one.